The importance of brushing twice a day has been drilled into us from a young age, but how many of us are actually utilizing the power of cleaning effectively? Hi guys, I'm Dr. Rajan. I'm a cosmetic dentist and implant surgeon, and today I'm going to be talking about brushing techniques. We'll be doing a brief overview today about how you can tune up your brushing skills in order to keep your gums and teeth nice and healthy. I'll be covering the difference between an electric and a manual brush, strategically walking you around your mouth to ensure that we're covering all the bases, and we'll be giving you extra tips and tricks on the little things that we look for to reduce your anxiety when you walk through that door. From losing a single tooth, a multitude of problems can arise from the struggles of eating, ultimately spiraling towards health problems, as well as mental health impacts from confidence barriers in your smile. These are all preventable problems which you can avoid by routinely using the tools I'll be equipping you with. A study collecting evidence from over 30 years clearly shows the benefit of an electric toothbrush over a manual, so go get one. What do we need in this brush specifically? An oscillating head, a pressure indicator as we don't want to be scrubbing so hard that we're pushing your gums into recession, and a timer counting down the seconds to make sure that you have all the areas covered. A commonly asked question is, what time of day should we brush? Should we brush before or after eating? Brushing soon after eating can cause damage to the enamel, and it is generally suggested to leave your teeth from 30 minutes to an hour prior to letting those bristles do their work. Working around our ever busy schedules and finding the motivation to incorporate brushing into our routines can be a struggle, especially after an extremely heavy day. But I suggest that the best way to overcome this is by listing out the factors which are stopping you and working towards bringing it into your routine step by step. Now I want to keep this simple. Point number 1. We'll be using the modified Bass technique, which in simple terms is just aiming the toothbrush towards your gum line at 45 degrees to ensure that we are scooping everything up from under the gums using short strokes. Point number 2. Let's separate the mouth into 4 areas and keep the brush in each area for 30 seconds. With your electric toothbrush, when the brush vibrates a couple of times, this is our cue to move to the next section of the mouth. Point number 3. To rinse or not to rinse. Once we've put in all the effort of removing all the food debris, evidence suggests that allowing a fluoride toothpaste to sit on your teeth can protect your teeth from bacteria causing decay. It's time to spit and not rinse. Speaking of decay, we routinely take x-rays to catch the bacteria early on in their tracks from causing holes. Now, a vast majority of these holes are actually caused in between your teeth, which are tricky areas to get our electric brushes into. So what do? Floss, interdental brushes, water flossing, anything to dislodge that food from between your teeth. I personally recommend using TP brushes, which should be selected on the basis of snugly fitting between the gaps in your teeth. The benefit of this is twofold: prevention of decay and prevention of gum disease, which I cover in detail in my gum disease overview video. I hope that you guys have found this video useful and feel completely free to get in touch if you have any questions. Thank you.